Good morning, and thank you, Mr. Chairman and members of the committee, for the opportunity to testify today. My name is Nicholas Armstrong, and I'm a policy analyst for the Center on Health and Families at the Texas Public Policy Foundation. I'm here to testify in support of HB 296, which would create an alternative licensing pathway for foreign licensed doctors to come practice in Texas. Texas is facing one of the nation's worst healthcare shortages, and it's only projected to get worse. Here's a current snapshot of the healthcare landscape in Texas. Texas is projected to be short 10,330 doctors by the year 2032. 37 counties do not have a single primary care physician. 20% of Texas's current physicians are over the age of 65 and are expected to retire within the next 5 years. In short, there is a low supply of physicians that is failing to meet the rapid demand of Texas is increasing patient population. Therefore, policies that bring more doctors into Texas should be considered. There are doctors in other countries that want to practice here in Texas, but might not based on the requirement that you repeat a U.S.-based residency. So for example, if a doctor wanted to license in another country, wanted to practice medicine in Texas, they would be required to repeat that U.S.-based residency, which is the equivalent for some of them to repeat anywhere from 3 to 9 years of training, depending on their specialty. This redundant requirement prevents top-tier medical talent in other countries from serving Texas patients right here in Texas. Right now, 10 other states have passed this bill that have created this alternative licensing pathway. And as the representative had mentioned before, they would be omitted from the residency requirement with the requirements that are laid out in the bill. After those requirements are met, they'd be issued a provisional license and practice under the supervision of a fully licensed doctor for 4 years. Once that 4-year provisional license period is over and they're not subject to any disciplinary actions, they'll be issued an unrestricted license to practice medicine in Texas. Texas needs more doctors now, and HB 296 would be an important step in increasing Texas's physician workforce and improving patients' physical access to physicians. Thank you for your time and your consideration, and if I can answer any questions that you guys might have.
Okay, thank you. Members, any questions? Representative Pearson.
Thank you, Chairman. Thanks for being here, Mr. Armstrong. We've been hearing about the physician shortage for quite some time. What are some of the contributing factors to the shortage?
Some of the contributing factors would be, as previously mentioned, the residency slots and those limited slots that was capped back in the 90s because they're tied with Medicare subsidies, and so that is one of them as well. Also, there are doctors they'll go practice in other states. In Texas, from 2000 to 2019, 50% of Texas medical schools graduates left the state to finish their education elsewhere, and so certainly there could be somewhat of a retainment factor, and with those residency slots as well would be some of the contributing compounding factors.
So does this bill eliminate the number of residency slots, or does it increase them?
It does not increase them. What it does is, these doctors would, under the current system, they would have to apply for a residency slot right now after they get all of after they hit all of their the requirements. If this bill were to pass, they would not have to apply for a residency slot. They would have to hit all the requirements, but then they would be issued that provisional license to practice medicine. So it does free up a residency slot in the sense that they're no longer having to apply for a residency slot. If they hit all of the requirements in the bill, they would then be able to be issued a provisional license to practice under a fully licensed physician in Texas.
Okay, so a U.S. physician would still have to apply for a residency slot, whereas a foreign physician would not.
They would have to already be in good standing with their own medical board, been practicing for 5 years as the bill describes. But they would be able to omit the residency requirement based upon they have completed similar training in another context.
So that's in lieu of residency.
Correct.
Okay.
Yes, correct.
We hear a lot over the years about physicians and the shortage. We were told that capping malpractice would make more physicians come, and yet here we are. How many physicians did you say we're going to be lacking? 10,000?
The Texas Health and Human Services has that projected at 10,330 by 2032.
And are are there any other factors of why we have a shortage of physicians other than the shortage of residency slots, which we're not changing in this bill?
Yes, not changing. There could be, you could make the argument that there's less independent doctors right now. I believe in the paper we discussed some of the corporate practice of medicine where private equity firms or others are buying up practices or buying up doctors. So kind of that independent slot where, possibly that leads to physician burnout. But that's a different problem that doesn't necessarily go within the scope of the bill. But that would certainly be something to be considered. But like I said, it's not addressed in the bill or anything like that.
Okay, thank you.
Yeah, thank you.
Representative Alcott.
Thank you, Mr. Chairman. Mr. Armstrong, just so I understand along the lines of Representative Pearson's questions, so the shortage isn't really so much due to the number of medical school graduates, it's more the residency slots. Is that from what I understand?
I think it could be both. There's of course the residency slot issue with all of the competitiveness, but also with the graduations. Yes.
Okay. What is the primary barrier to increasing the number of residency slots? Is that, I think I saw something maybe in your document mentioned that we needed to wait till Congress to act. Why is that? Why can't Texas do something about increasing the number of residency slots?
Yes, absolutely. So the federal government is the primary funder of that general medical education, and the residency slots are funded with those federal dollars. There's nothing stopping a hospital or the legislature with funding more of those residency slots. However, it's primarily tied up at the federal level.
Because I know this isn't related to this particular. Well, it's related to this bill, but it seems to me that's something that if that's something that Texas could do instead of waiting for Congress, it seems like that would be worthwhile. Because it's a shame you said 50% of medical school graduates in Texas actually leave the state. Is that to leave to do residency elsewhere? And have you ever tracked to see how many of those actually come back to Texas?
I don't have those numbers, but I could follow up with you afterwards, or follow up with your office if to get those numbers of how many go elsewhere and then maybe come back to Texas.
Yes, if you could provide my office, I'd love that.
Sir,
and one last question. You mentioned something that one of the things, if I understood correctly, that discourages some physicians to actually practice here in Texas is the fact that some of these corporations are buying up doctor practices. And is that discouraging some physicians to actually practice here in Texas? Is that like a disincentive? Would you characterize that?
I'm not entirely certain if it would be a disincentive. I have some friends who are doctors who do mention some of the private equity buying up with doctor offices, and they don't necessarily can make practicing independently. But that is kind of outside of the practice of is a separate issue, but could definitely be a contributing factor.
And so like some of these physicians say, I'd rather go open up my own office in Louisiana rather than practice here in Texas because I don't want to be working for a company. I want to work for myself. Is that what you're...
That could, yes, that could possibly be an issue as well.
Thank you.
Okay, Representative Simmons.
Thank you, Mr. Chairman. Good morning. And I really appreciate, the addressing the need of the doctor shortage, but I want to also just make sure that we remember it's a number of factors, and Texas has some extremely restrictive laws around certain forms of medicine that are being practiced, which it would increase brain drain. You won't come here and practice if you could potentially ruin your career or go to prison. So I want to make sure that we are putting that out. But really quick, medical licensure in Texas really doesn't require doctors to actually live here. So does this bill create any protections that would prevent out-of-country doctors from acquiring a medical license in Texas only for them to remain in their home country and just, for say, practice exclusively via telemedicine? Is there anything that would require them to actually be here in the country providing those services in person? I mean, they could still do telemedicine, but actually being here.
Yes, I do believe they would have to be physically in the state to practice that.
Thank you.
Representative Jones.
I just want to be clear.
Yeah.
So foreign physicians would not be replacing residents, right?
They would not be taking residency slots. They would not have to apply for residency slots that under the current system, if a foreign licensed doctor wanted to practice here, they would have to repeat their residency. And so you have these two competing. You have the recent U.S. medical graduates, and you have the foreign licensed doctors all going for the same residency slots. Under this bill, what would happen is, as long as you hit all of the same requirements laid out in the bill, you would practice under the supervision and have that provisional license.
Right. So then they wouldn't be, because I can already hear the clutter saying that you letting foreigners come in and you knocking out American medical students who've paid all this money,
Mm-hmm.
blah, blah, blah.
Mm-hmm.
So I want to be clear that this bill does not have foreign doctors competing with residents, because they've already been doctors wherever it is they've practiced. They have 5 years of experience, and so they would have a provisional license as opposed to being a resident where they are supervised by a physician in good standing. Is that accurate?
So you're saying that, or please correct me if I'm wrong, but so that they're competing in what
No,
sense?
what I'm saying is they're not competing.
Oh,
I'm saying foreign doctors who want to come here,
yes.
who currently aren't coming here because of all the restrictions,
Mm-hmm.
one of which is they're competing against recently graduated medical students.
For the
There
residency
is no
slots.
competition, is what I'm saying. This is a whole separate track than residency. Is that accurate?
So you're saying that they would have to compete with the foreign doctors whenever they get
I
a
am
license?
actually
or
saying
is
the
that,
opposite.
so they would have to be, is that what, am I understanding that
Let me
correctly?
try one more again. Testifies. I just want to be clear that the foreign doctors who want to come here and help us
Mhm.
are not competing against residents or people who are vying for residency. They're two separate things. So the new residents, the new doctors who want to apply for residency spots literally don't have to beat out the foreign doctors. The foreign doctors are doing something different.
Mhm.
They are trying to get a provisional license because
Yes.
they've met the requirements to practice under a physician.
Correct.
I think I'm making the argument, but I think I may not be doing a good job of explaining it. So there's no competition between the foreign doctors and the residents.
For the resident, if this bill were to pass for the residency slots, there would be more doctors in the state, which, with the laws of supply and demand, there would be
Right, but-
competition. But as far, it would remove the competition for the residency slots, or for applying the need to apply for the residency slots.
And the way that it is now, I'm gonna try this one more again. I think what you're saying is that there is no competition for the people that are saying, hey, we don't want foreign doctors to be able to come here because they literally are taking up spots for residents. Instead, we're saying, no, Texas, we will increase the number of physicians because the foreign doctors have a whole provisional licensure pathway where they still get to come here and practice medicine. And the residents who are from here,
Mhm.
we're going to compete for those spots. So we're creating more physicians actually practicing here
Yes.
rather than the limited.
Correct.
Did I get that right?
Correct. Correct.
Thank you. That's all I wanted to make sure of.
Thank you.